Hi, I'm Dr. Allison Karosky-Mazey, the CEO and Chief Medical Officer of HopeWay in Charlotte, North Carolina. I'm also the president of the NCPA and would like to welcome you to the 2021 conference. HopeWay is a nonprofit, physician-led program. We specialize in residential and day treatment services and combine medication management, individual and group therapy, integrative therapies, meditation, and mindfulness, along with a host of other modalities to support long-term recovery. HopeWay also has an outpatient clinic, HopeWay Psychiatry and Associates, to complete the continuum of care. Additionally, in 2021, we launched our Veterans Program that offers intensive, specialized treatment for veterans with PTSD and other mental health conditions. We are honored to be able to serve our nation's heroes. HopeWay is proud to also be a platinum sponsor of this year's conference, and I'm excited to welcome Dr. Greer Mitchell to the HopeWay team. She joins us from Duke University as a passionate advocate and provider for those struggling with eating disorders and disordered eating behaviors. She is a true visionary, and her approach to treating eating disorders and co-occurring conditions is vital for the field as individuals and families continue to struggle with these difficult disorders across the nation. I hope you enjoy hearing from her today.
Hi, I'm Dr. Greer Mitchell, and I work as the director here at HopeWay Center for Eating Disorders. I'm really passionate about eating disorders, and something I come across a lot is that people feel uncomfortable with this topic, so I'm excited to get to talk to you more about it today. The increasing prevalence of eating disorders, coupled with the lack of resources both nationally and within the state of North Carolina, makes this a really concerning issue. I'm really excited to join HopeWay's team and to work within the multidisciplinary approach that HopeWay already built and to expand services for these individuals. Eating disorders are very common. It's estimated between 1% to 4% of individuals will be diagnosed with an eating disorder at some point during their life. However, this doesn't include pathological weight loss from medical or psychiatric illnesses. It doesn't include relative energy deficiency syndromes, and it also doesn't include atypical or subthreshold eating disorders. You can't tell if somebody has an eating disorder just by looking at them. And most important of all, it's one of the highest mortality rates of any mental illness. One of the most common questions I get is, how do I even talk about eating disorders? I think a lot of people get really nervous about the language they're using and whether or not the specific term is going to trigger an individual when they're trying to help them. I might use different language when I'm working with an individual who I think is struggling with an eating disorder. For instance, instead of saying calories, I might use a word like energy. Instead of using a word like food, I might use nutrition or nourishment. Instead of saying something like skinny or thin, I might say something like undernourished. I think it can be really challenging to understand just how triggering these common day-to-day words like food, meals might be for an individual who's struggling with an eating disorder. But the eating disorder is based on fear that some horrible consequence is going to happen when you sit down to enjoy something like a meal. The joy goes away and it's replaced by fear. And that's what makes these words so traumatizing and triggering. Eating disorders often go missed or undiagnosed for a long period of time, which further complicates the course of illness. There are great screeners that you can use in clinic, like the Eating Attitudes Test or even a 24-hour recall. There are even short screeners that you can use, like the SCOFF or the ESP, but a lot of times those screeners have problematic language or triggering language. When I'm working with an individual, I try to make things more conversational and I try to use language that won't be as triggering to them. Some questions I might ask include, are you worried you may have an eating disorder? How often do you worry about your body weight or shape? How often do you restrict your intake or avoid certain types of nourishment? Why do you restrict your intake? Are you worried about gaining weight? Are you concerned about having nausea or vomiting or choking? Are you sensitive to certain textures, tastes, or smells? Do you ever overexercise, vomit, or take medications to make yourself lose weight? Do you ever feel like you've lost control during a meal? As many of you know, the conversations around mental illness are finally catching up to the way that we think about medical or physical illnesses. However, a lot of people are still really uncomfortable talking about eating disorders, whether it's the language or just learning how to recognize them or how to talk to their friends and family about eating disorders. And so in many ways, eating disorders are going undiagnosed, they're going missed, and people are struggling for much longer, similar to how depression and anxiety used to be 10 to 20 years ago. I hope this information has been helpful, and I hope that some of the language and information that you've learned today will help you in treating patients in the future.